The OTSC Anchor is a flexible endoscopy product for use in the gastrointestinal tract. It helps to mobilize tissue, especially if it has scarred changes such as fistulas or ulcers. The needles of the OTSC Anchor are made of a super elastic shape memory alloy. When extended from the tube, they return to their original expanded shape and anchor in the tissue. For use in thin tissue, the OTSC Anchor is also available with a smaller insertion depth and a longer flexible shaft. The OTSC Anchor is supplied with splayed anchor needles. Before use, the sliding handle is pushed back to fully retract the anchor. The locking button is not pressed and must audibly engage. The instrument can be used in combination with the OTSC system or for certain indications with the FTRD system. If the anchor is inserted through the same working channel as the release thread of the OTSC clip, the diameter of the working channel must be at least 3.2 millimeters. To place the anchor in the tissue, the instrument tip is positioned on the appropriate point while the needles are fully retracted. The locking button is then pressed to release the sliding handle. By pushing it forward, the anchor needles are spread open into the tissue. The OTSC Anchor thus enables precise alignment between the tissue and the application cap, facilitating lesion adjustment. To minimize tissue tension, the endoscope is advanced along the instrument. Before clip application, it is important to ensure that the tissue is retracted far enough into the application cap. During clip placement, the instrument shaft is fixed with the fingers. Once the clip has been applied, the anchor needles are retracted and the instrument detaches from the tissue. The anchor can then be removed from the working channel to inspect the application site. Further information on the correct use of the product can be found in the instructions for use.